Okay, so I'm Emily Coleman, and I did my presentation on equine recurrent uveitis. So, okay. Equine recurrent uveitis is also known as moon blindness, which is inflammation of the uveal tract of the eye, which is the middle layer of the eye. And recurrent uveitis occurs after it has occurred multiple times, after the inflammation of the eye has occurred multiple times, and it becomes like a chronic issue. It's a very common eye health problem in horses. It affects between 2 and 25% of horses worldwide. Um, it can occur once and not cause any further complications, but more often than not, it occurs more than once. Um, Recurrent uveitis usually ends up causing glaucoma, cataracts, or eventually complete blindness. So here's just some pictures. You can kind of see why it would be called moon blindness. I think it's gray and filmy over the eyes. The cause of recurrent uveitis is due to bacteria infecting the eye, and it causes inflammation. It's leptospirosis bacteria. It's really common in regions with mild climate. And then also it can be caused by a parasitic infection, which is Onchocerca cervicalis. And it's known to be an autoimmune disease in horses, and it could possibly be caused by vitamin deficiencies of A, B, and C vitamins. Epidemiology, it's an autoimmune disease, evidence-based because of the recurrent nature of the inflammation of the eye. And honestly, the start of the disease is still sort of unclear. People don't really know why leptospirosis causes irritation in the eye and causes it to be inflamed. Leptospirosis is the most common zoonotic bacterium in the world, which means it can be transferred from humans to people or humans to animals, and like vice versa. Horses are accidental hosts after consuming contaminated water, which has urine from carrier species in it. And a horse that consumes contaminated water can actually shed bacteria, leptospirosis bacteria, in their urine for about 5 months after. And then uveitis will occur 1 to 2 years after exposure. So it takes a while to develop. Pathogenesis, leptospirobacteria is the main cause of equine recurrent uveitis. The carrier species pass urine into the water. Horses consume the water and become infected. Bacteria can stay in the body for almost 6 months, infecting others along the way. Uveitis takes between 1 to 2 years to develop after exposure to the bacteria. It makes it really hard to trace, and it's sort of hard to diagnose the source, where it came from, and it's hard to stop the spread because the half-life of the bacteria is so long. Clinical findings, it was found that there's 3 different subtypes of equine recurrent uveitis. The first one is classic. This usually consists of periods where the eye is super inflamed, like active inflammation, which is followed by periods of no active inflammation. And those periods of no inflammation are like usually unknown lengths. They can vary in time. Usually if these events occur more than once, it'll cause gradual vision impairment or total loss of vision. The next one is insidious. This is persistent, low amount of swelling in the eye or eyes. It's more of a genetic thing, especially in Appaloosas. It leads to slow destruction of ocular tissues, which in time cause total vision loss. And it's even more so seen in Appaloosas with the leopard print gene. And then the last type of equine recurrent uveitis is posterior, which is inflammation at the back of the eye, and it causes retinal degradation. It's often seen in giraffe breeds and European warm bloods. That type is not as commonly seen like in the United States because it's seen more in Europe because the climate is different there. Diagnosis, when the symptoms are apparent, it's easy to diagnose this disease because you can obviously see it. It's super cloudy over the eye. The horse often will react, and like it might even be painful for the horse. However, when the horse is in a non-active period of the disease, or if the horse is infected and you don't even know it yet, like it's before the 1 to 2 years before it starts to show symptoms, it can be very hard to know if a horse even has any amount of leptospira bacteria in it. Also, before the disease makes an appearance, like I said, the carrier could be spreading bacteria to other animals and it wouldn't be obvious. If you do find out that the horse has uveitis, it's important to keep the animal in a dry environment, like as dry as you can possibly get, away from the other horses until the disease subsides or shows signs of being inactive. And then treatment, there's no cure for recurrent uveitis. There's ways to like manage it and treat it. Like I said in the last slide, keep it in the driest environment possible. There are only vaccines for cattle and ruminant animals that are known to work. There's no equine vaccine. Some vets do use the cattle vaccine, but it's not approved, and it's they'll usually have you sign a waiver or something before you would do that. But if the inflammation becomes overly painful and like persistent, it's every day, the vets would suggest removing the eye that it's hurting. And then prevention, once again, it's pretty hard to prevent because bacteria is just hard to know. It's hard to see. Keeping horses away from outside water sources, besides like their troughs and automatic waters, could help prevent them from like consuming contaminated water, consuming bacteria. And then if you immediately remove an infected horse, it could prevent further spread in your herd. And then the last resort would be to remove the eye if the horse would be in constant pain, to prevent the horse from being in pain all the time. But there's no real cure for it, so. And then these are the references.